On the record at 9:08 a.m., September 30th, 2015, is the videotaped deposition of Jeffrey Weil, MD. Will all counsel please introduce themselves?
My name is Clint Kelly and I represent Dr. Ayamu.
Sarah Reynolds for Vanderbilt.
Will the court reporter please swear in the witness?
Would you raise your right hand, please? Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Dr. Weil, I'm taking your deposition today to determine what you'll testify to as a witness in the trial of this case, and I'd like to get a couple of agreements out of the way before we proceed. First of all, I'd like you to agree to answer all of my questions to the best of your knowledge and information. Will you agree to do that?
Yes, I do.
Secondly, I'd like you to agree to answer my questions not only to the best of your knowledge and information, but also to your best of your understanding. So if I ask a question that you don't understand or is capable of two meanings, I want you to say, Mr. Kelly, please rephrase, and I'll be glad to do that. Otherwise, I'm going to assume you understood my question. Will you agree to do that?
Yes.
All right. I understand you've testified before because I got a case list from your lawyer, Coombs versus Glinsky, is that correct?
That is correct.
All right. Tell me about that case. I understand you testified at trial.
I did.
All right. Can you tell me about the case?
It was a case in Washington State, a case of wrongful nephrectomy.
And what is a wrongful nephrectomy?
It's when I believe they were concerned about the details of. I'm sorry, it's a little bit of a general question.
Well, can you describe for the jury what was the issue that the plaintiff was suing over in that case?
They were concerned about whether or not the kidney should have been removed.
All right. And were you retained by the plaintiff or the defendant in that case?
I was retained by the defendant.
And who was the defendant?
I don't recall.
Was it Dr. Glinsky?
I believe so, yes.
All right. What kind of doctor is Dr. Glinsky?
I believe there might have been two defendants in the case, but I don't recall exactly. There was a radiologist that was named, and I believe also a urologist.
All right. Were you retained by the radiologist?
I don't recall exactly if it was just the radiologist or how exactly the defendant, the case was structured.
Well, do you recall what your opinion was in that case?
I was asked to give an opinion on imaging findings in the case.
All right. And you actually testified at trial, correct?
That is correct.
I assume you gave a deposition as well.
I did not.
You did not. Is there any other occasion in which you've testified other than in the Coombs versus Glinsky case?
There's no other case in which I've testified or given a deposition.
Do you remember the name of the lawyer that hired you in that case?
I believe it was Thorner.
Thorner?
Yes.
Thorner?
That is correct.
You remember his first name?
I believe it was David.
And where is Yakima?
Yakima?
Yakima.
Yes.
Sorry.
It's in Washington State.
Well, I know that. I can see that from your disclosure here, but I mean, is it around Seattle?
It's east of kind of the mountain range, the Cascades there.
Do you know what the jury verdict was in that case?
I believe they found for the defendant.
Okay. The radiologist?
The radiologist and whoever else might have been named in the case. That is my recollection.
Doctor, tell me what you did to prepare to testify today.
Basically, just reviewed the information that was in the chart and the images that I reviewed on the day in question.
The chart that you reviewed, was it in this notebook here we've been using in this lawsuit?
I got the name of the patient from counsel, and I will say that I did not review that notebook, just what was in the medical record at the time.
Does that mean you went through Star Panel?
Yes, I did.
All right. And did you review the progress notes?
Not all of them, no.
Okay. Which progress notes did you review?
It was some time ago, but I reviewed my own report and interpretation and the progress notes that I felt would be most relevant to my interpretation at that time, which would have been the emergency room notes. And I don't remember specifically which other progress notes I might have reviewed.
Right. Is it possible you reviewed the internal medicine notes from Dr. Haller, Carlo, and or Dr. Birdie?
I may have looked at them, but because they were generally beyond the time of my interpretation, I don't recall exactly what details I might have pulled out of those. Or I looked at those potentially, but I don't recall exactly what the detail and substance of those notes was.
Anything else you did to prepare for your testimony today?
I had conversations with counsel.
Anything else?
Not as I recall, no.
I assume you hold yourself out as an expert in radiology, correct?
Yes, I do.
Expert in reading CT scans?
Yes, I do.
And expert in detecting abdominal bleeding?
I would say yes, that is the case.
Now, other than this one time that you testified in Yakima, Washington, have you been retained as an expert in any other case to review it?
I believe 2 other cases,
And where were they?
also in Yakima, Washington.
Do you remember what they were?
One was a case of bowel obstruction, and I don't recall actually the other case. I gave an opinion, and it was some time ago, and I was never contacted again.
Were you retained by the defendant in both of those cases?
That is correct.
Have you reviewed any cases that have...
Actually, if I might add,
Sure.
I am not certain that it was the defendant in each of those cases. I was not told when I reviewed the imaging on at least one of those cases whether it was defendant or plaintiff.
How was it presented to you?
They asked me to review the information in the case. They asked me to render an opinion. I did, and then I was not contacted again, so I was not told whether it was plaintiff.
They
or
being the
defendant.
attorney?
Yes, sir.
All right. I assume you don't hold yourself out through any expert service finder, is that correct?
That is correct, I do not.
Who asked you to serve as an expert in this case for Vanderbilt?
I was contacted by the Vanderbilt Risk Management and asked to speak to Ms. Ross. And then I had a meeting and email exchange with her.
And what was the substance of that meeting?
Objection to the form. He's a Vanderbilt employee and is represented by counsel.
He's an expert, is he not?
Well, we disclosed him out of an abundance of caution so that we could shed some light on the interpretation of the film that he read as a treating physician because of the federal court requirements. But he's really not testifying about anything outside of the care that he provided in this case.
Okay.
So no.
All right, are you going to instruct him not to answer the question?
I'm going to instruct him not to answer any questions about what it is that we have discussed.
All right, let me get on the record. First of all, my question to you is, what discussions did you have with the risk manager when you were contacted by her to discuss this case?
The risk manager gave me the medical record of the patient and asked me to contact counsel and asked if I'd be willing to discuss the case further.
All right. When were you contacted?
I'm trying to remember, I don't remember the exact date. It's been within the last month and a half.
All right. And you contacted Ms. Ross, is that correct?
I was asked whether or not I'd be willing to do this. I said yes, and I don't recall whether Ms. Ross contacted me or I contacted Ms. Ross.
Willing to do what?
Willing to review the information in the case and answer questions relative to the case.
Okay. Were you asked to give opinions in the case?
Yes.
All right. And then you met with, I assume, Ms. Reynolds?
Yes.
Did you meet with anybody else other than Ms. Reynolds?
No.
Now, I'm just going to get this on the record, okay, because I know what you're going to say, but My question is, what did you discuss with Ms. Reynolds?
Object and instruct not to answer. Basis of attorney-client privilege.
What were you asked to do in this case besides give opinions?
That is the only thing that I was asked to do in this case.
Do you know why you were asked to do this?
It's not entirely clear to me. I did read a scan on this patient, and I assume it's related to that.
Well, let me ask you this. Were you told that Vanderbilt was sued in this case?
I was told that there was a lawsuit. Yes.
Okay. Anything else about the lawsuit other than there was a lawsuit?
Nothing else about the lawsuit.
Do you understand you were not the subject of the lawsuit?
That is my understanding.
Do you understand no one has made an allegation that you departed from the standard of care in this case?
That is also my understanding.
Who's paying you to give your opinions in this case?
As I understand it, I'm not being paid to give my opinion.
So you're doing this for free?
I was not asked for a fee schedule, and I have not provided one.
Are you charging Dr. Ayamu for your time in this deposition today?
I am not.
Are you going to charge Vanderbilt to testify at trial?
No,
Vanderbilt's your employer, is that correct?
that is correct.
And I looked at your CV, but I'd like you to state on the record, when did you start working for Vanderbilt?
In 2008,
What month?
I believe it was August,
And what position did you take?
assistant professor of radiology and radiological sciences.
And have you maintained that same position through today?
Yes, I have.
All right. Is Vanderbilt the Is Vanderbilt the sole source of your income?
Yes,
Do you know Dr. Birdie?
not other than by name.
Do you know Dr. Stein?
I do not.
Before we get into your role as a radiologist, I want to make sure we're clear. You've talked to Ms. Reynolds, talked to the risk manager, probably had a phone call with Ms. Ross to set things up. Is there anyone else you've talked about this case with?
Other than my supervisor to let him know that I will be here today? No.
All right. I want to talk about your role as a radiologist. It's my understanding you're going to give an opinion at trial that you and I guess Dr. Buchanan complied with the standard of care. Is that correct?
If that is what I am asked, that would be the opinion that I would give, yes.
All right. That's what I got from your report. What I didn't see in your report was that you were going to give any opinions about whether or not anybody else complied with the standard of care.
That's correct.
I would only give opinions that would apply to my scope of practice.
All right. You've never met Miss Ayamu, have you?
I have not.
Never laid hands on her?
I have not.
And as your role as a radiologist, you don't know her labs?
I do not.
You didn't know her clinical picture on the morning of May 10th?
I did not.
Didn't know her hemoglobin trend on the morning of May 10th?
I did not.
You don't perform blood transfusions?
I do not.
You're not responsible for ordering a CT scan?
I am not.
You're not responsible for making treatment decisions for Mrs. Ayamu?
I would not have been.
Who was in charge of Miss Ayamu's care?
I do not know.
Doctor, what is the difference between a preliminary read of an imaging study and a final read that's in the chart?
A preliminary read is a read that would have been performed perhaps at our institution by a resident or an attending in a preliminary fashion, and a final read is the final product that would have been generated from that read.
Or let's talk about Ms. Ayamu's case in particular on May the 7th. Can you tell me what the preliminary read was on May 7th?
I cannot.
Okay. Obviously, I can see the final product in the chart, which is what was typed up and entered into the chart that you electronically signed.
Right,
I assume that would be called the final read, correct?
that would be.
All right. Do you know when the scan was ordered on May 7th?
I do not.
How can we tell?
I assume that that data would be in the IT system, but I don't know an easy way to tell that information.
Okay. Can you tell me when the scan was performed?
I can look on the acquisition time here, and it would tell me when the scan was performed. And it should be actually potentially on the report. I'm not sure.
Well, let's look at the report. Can you access that? Do you have that? Because we're going to be talking about it.
I'm not sure how to access a report from this software.
All right. Let me give you my chart because I think it'll be helpful. I'm going to
It may be
refer
helpful.
to VU 172. You can put that in your lap if you want to, make it easier
Certainly.
for you.
Yes.
Okay. I see what appears to me to be a performance time of the scan of, is it 12:23?
12:13.
12:13, pardon me. Would that be the time at which the scan was performed?
That would be.
All right. And tell me when, if you can tell from that report, when Dr. Buchanan published his opinion by final read in the record.
2:29 p.m.,
And tell me when you electronically signed it.
3:13 p.m.
All right. Now I want you to hang on to that chart for a while. Can you tell me what history Dr. Buchanan got?
The history that is given on the in the history section of this report is right lower quadrant pain.
Any other history?
There is no other history.
All right. And if you can walk me through the process on that particular day, how does this work in radiology? And what I mean by that is just walk me through the sequence of events from the time that the patient comes in to have the scan performed through the time at which the final read is published in the chart.
I don't remember the details of that specific day, but I'm happy to tell you how, in general, it works in radiology.
That'd be fine.
Okay. In general, the patient will come, a referring physician will order a scan. The scan will be performed. If a resident reviews the case preliminarily, that case is reviewed, and a preliminary read will be provided to the emergency department unless the case is in a draft format, in which case there will be no communication other than verbal communication with the emergency department until the report is signed.
All right, let me stop you there because I don't think I understand. What do you mean by unless the case is in draft format?
If the resident reviews the case and leaves it in draft format, it is in the queue for review by the attending, but is not visible, to my knowledge, to the emergency department.
All right, when you say the attending, does that mean you?
That means me.
All right. And on May the 7th, were you the attending radiologist?
I was the attending radiologist.
And was the resident Dr. Buchanan?
Yes, he was.
All right. Did you review the CT scan of the abdomen and pelvis after Dr. Buchanan looked at it?
Absolutely.
All right. Did you talk to Dr. Buchanan about it?
Absolutely.
All right. Do you remember what you discussed with him?
I do not remember specific discussion with him, but in general, we review all cases with the resident, and if there are pertinent findings that need remediation or discussion, then it is handled at that time.
Can you tell from looking at that final read whether there were any findings that needed remediation?
No.
Did you discuss those findings with Dr. Fitch?
There's no indication here that I did.
Did Dr. Buchanan discuss it with Dr. Fitch?
Also no indication that a discussion occurred.
Okay, can I have my chart back just for a second?
Certainly.
Get a
Reason-
page number?
I do. Doctor, the reason I asked you this question, I'm going to hand this back to you, is on
Certainly.
Vanderbilt 106.
Okay.
I understood you did read this part of the chart, the emergency department chart.
Okay.
I highlighted that there in yellow.
Okay.
It appears that Dr. Fitch is at least saying in that note that he had some discussion with radiology. Is that the way you read that?
It is.
Okay. Is it possible then that someone from radiology, whether it was you or Dr. Buchanan or perhaps someone else, actually discussed the findings of this CT, pelvic CT, with Dr. Fitch?
It is possible, and I would say very likely based on this statement.
All right.
I did not see an indication in our dictation that would have indicated this.
Is it your customer practice to discuss findings with the emergency department physician when they order a scan, such as what the scan that Ms. Sayama had?
If there was an unexpected finding,
Uh-huh.
then we would communicate that finding.
Okay.
If the finding fell in line with the indication for the study and was not determined to be unexpected at that point, the report and findings would be relayed via the final report.
Okay. Can you tell from looking, I have to go back here, let me take you back to the report. We're back now to VU 172 and 73. Can you tell me from looking at that report whether there were any unexpected findings?
Based on the indication, the only unexpected finding that I see here potentially is the irregular soft tissue mass.
Okay. Do you know what the irregular soft tissue mass was?
I do not.
Is it the responsibility of, in this case, the emergency department physician to follow up with that finding of yours and make a determination of what that is?
It would be.
Okay. Would it also be the responsibility of the emergency department staff to follow up with your finding of a small amount of pelvic fluid and determine what that is?
Objection to the form.
Go ahead, you can answer.
That would determine whether or not it was considered to be unexpected.
All right. But you don't make a determination of what that small amount of pelvic fluid is that was found on the CT scan, correct?
We are able to measure the density of pelvic fluid and assign it some significance depending on that density. But I do not make that determination.
Would that be would that determination be made customarily by the person who ordered the scan?
I'm not sure I understand.
Well, I'm trying to figure out who makes the determination, if the determination is going to be made. Is it the person who orders the scan? Follows
Objection.
up with it?
Objection to the form.
I'm not sure that I am able to answer that question. It's kind of outside my scope of practice as to who would be required to follow up on that.
But it's not you, correct?
That is correct.
And it's not Dr. Buchanan either, is it?
That is correct.
All right. Would you hang on that chart?
Okay.
Do you know if anyone ever determined what that small amount of pelvic fluid was that you found and Dr. Buchanan found on May the 7th?
No.
Now, let's take a little break here. What I would like you to do is I want you to pull up on your computer there
Leave that page open.
the scan that you think, or the images that you think best demonstrate where that small amount of pelvic free fluid is. And Mr. Videographer, yeah, when you,
Oh goodness, this is. But should I move over here and turn this way, it's going to be a little difficult to.
Can you, move your camera around, because
Okay.
I want him to be comfortable when he does this.
Let me go off the record.
Okay.
Off the record at 9:33. Back on the record at 9:35 a.m.
All right, now, doctor, before we start pointing out things on that CT scan, can you tell me what the, let me read over your shoulder here just a little bit.
Okay. Here, let me.
Those numbers at the top left where it's brilliance and goes down, can you describe for the jury what those numbers and letters mean?
The brilliance is the type of scanner. 64 is the number of detectors. I'm not sure what the EX129 number is representing there. This is the type and amount of intravenous contrast that was given. And this is the series number 2 of 5 and image number 11 of 152.
What kind of contrast did she get?
She got iodinated intravenous contrast.
All right, would you briefly describe for the jury what that does?
So contrast is injected through a vein. It increases the density of the blood pool and allows us to see vessels, and also passes through the organs and makes them brighter than they would normally be.
Will it help you also identify fluid?
In general, it's not helpful for identifying fluid.
All right. Let's go forward now, if you would, and can you just sort of orient the jury as to, in terms of the slices, what is the perspective here that we're looking at?
So the current perspective as displayed is what's known as an axial image. It is an image that is cut, if you will, through the body in this sort of plane here, perpendicular to the long axis of the body.
So if she were like a loaf of bread, would it be slices along the loaf of bread from head to toe?
That's a good analogy.
All right. And then can you describe for us, as we're looking at, we obviously see sort of an egg or oblong shape with some areas that are different colors. Can you orient the jury and tell us what we're looking at in there?
The heart, the liver, the aorta, the spine, and then the body wall around it with ribs.
All right. And can you tell me approximately where this would be along the, as we're going down the body from head to toe, where that slice would be approximately?
That is the lower part of the chest.
Okay. Is it above the belly button, below the belly button?
Above the belly button.
All right. Between the belly button and the chest?
It's actually through the lower part of the chest, just above the lower part of the ribs.
Okay. Go ahead.
Perfect.
You wanted to show us or I wanted you to show where that fluid is that was detected.
Takes a while to scroll.
Are we going down?
We are going down,
Or are we going past the belly button?
past the belly button.
All right. And when we eventually stop, doctor, give us an approximation where that slice is when you get to it.
Approximately there.
Okay. If the jury's looking at her from head to toe, we've gone past the belly button. Where do you think this slice is that we're looking at?
Below the belly button, but right in the area of the mid-pelvis. So
Above the genital area?
above the genital area, yes.
All right. Okay. But
Just below the belt line.
Great. All right, go ahead.
Okay. And in this area here, in the right adnexa, which is the ovary, adjacent to the ovary, there is a small amount of fluid. And it is visible only on 2 or 3 images.
All right, can you take, you can use the pointer there, the yellow pointer, or the cursor, either one, but I want you to show the jury where that fluid is, where you see it on that scan.
Right here.
All right, let's take a snapshot of that, Mr. Court Reporter.
I'll leave it beside it.
All right. All right. Before we leave this, Doctor, why did you or Dr. Buchanan decide to report that on the final read?
It is something that is mentioned in many cases of a younger female who is of childbearing age. It can be seen in cases of a small ruptured ovarian cyst and is considered to be normal in some cases, and therefore that would differentiate this particular finding as being would be considered abnormal in a male potentially, but not necessarily in a female.
Well, you may have answered my question, but why did you choose to report it?
There's some additional findings on the scan of fluid density, which are found about the kidney and in the right retroperitoneum, which may or may not have been related, but in general, we report those findings to differentiate what might be considered normal in one patient from what might be considered abnormal in another.
All right. Do you or have you read the autopsy report in this case?
I believe I looked at it.
Okay. Did you understand that Dr. Wheeler found 2,600 cc's or 2.6 liters of blood in Miss Ayamu's abdomen and pelvis?
I'm not aware of the exact amount that was found, but that was my understanding that there was blood found.
All right. Is that blood in the general vicinity of where that small amount of fluid is that you've got the cursor on?
I don't recall the exact location of blood that was found on the autopsy, only that she bled.
All right. You got that snapped? All right. You can turn that around, Doctor. We'll go back to the questions.
Okay, thank you.
What we'll do for the record is he's going to make a snapshot of that, and we'll make that first exhibit to his testimony. You let me know when you're ready.
We're on.
Okay. Doctor, do you keep up with medical literature related to CT scans?
Yes, I do.
I assume as part of your practice, that's something that you do to keep up with any technical advances or any medical studies that have to do with interpreting or using CT scans, correct?
That is correct.
All right. Do you agree that CT is one of the most significant technical advances in the detection of abdominal bleeding?
As compared to
Anything else?
anything else, I believe it is used in that fashion.
You agree a CT is accurate for detecting, diagnosing, quantifying, and monitoring abdominal bleeding?
Yes.
Do you agree a CT finding of active abdominal bleeding is an emergency requiring prompt notification and treatment?
Yes.
Do you agree a large volume of blood may collect in the abdomen and pelvis?
Yes.
Will you describe for the jury what is a hemoperitoneum?
A hemoperitoneum is a collection of blood in the peritoneal cavity.
And where is the peritoneal cavity?
The peritoneal cavity is the cavity in which most abdominal organs reside.
And what are the main organs in the abdomen?
In the abdomen,
Abdominal cavity.
okay. The abdominal cavity is divided into different compartments. You've mentioned the peritoneal cavity,
Yes, sir.
and is that the specific cavity to which you're referring?
Well, let me ask you this, can you find a hemoperitoneum on a liver?
You can find hemoperitoneum within the abdominal cavity. The liver is one of the organs that reside or that is found within the peritoneal cavity.
All right. Do you agree that a spontaneous hemoperitoneum is an uncommon and often unsuspected condition that may be catastrophic if it's not promptly diagnosed and treated?
I believe that it is unexpected and rare.
What is a spontaneous hemoperitoneum?
A situation where you have bleeding that occurs spontaneously without clear cause or understanding.
Do you agree that a spontaneous hemoperitoneum may be associated with severe abdominal pain and distension?
That's not really my area of expertise. I would be more qualified to answer the questions regarding CT findings.
Do you keep up with the American Journal of, how do you pronounce that? Rentgenography? How you say that?
Radiology,
All right, I'll just call it AJR. Do you keep up with AJR?
I do.
All right, do you know what AJR says about spontaneous hemoperitoneum?
I don't know specifically.
Are you saying you would not know the signs and symptoms of a spontaneous hemoperitoneum in the abdomen?
I would.
Objection to the form.
You would? All right. Is abdominal pain and distension a symptom?
Again, I would be more qualified to answer the findings relative to the CT scan.
That's fine. And the reason I'm asking is I want to know, are you going to come to court and be able to say what the signs and symptoms are of a spontaneous hemoperitoneum?
I mean, physical or on a scan? I think there's
Physically,
maybe
yeah.
a miscommunication.
Not how it looks on the CT scan, but
Right.
what the symptoms and signs are.
Right. I would imagine that a patient could present with abdominal pain in the setting of hemoperitoneum. But in general, I would be more familiar with the CT findings associated with that.
Is it fair to say you're not going to come to court and tell the jury what the signs and symptoms are of spontaneous hemoperitoneum? Then I don't have to go through all this with you.
Right. I'm a little confused by that.
Let me just ask the questions. You say yes, no, or I don't know. I think
Okay,
that's the best
that's
way
fine.
to do it. All right. Do you agree that a spontaneous hemoperitoneum may be associated with severe abdominal pain and distension?
Yes.
It may be associated with a decreased hematocrit level.
Any case of bleeding could be associated with decreased hematocrit level.
Or more rarely, hypovolemic shock. Sorry. Let me read that again. Spontaneous hemoperitoneum may be associated with hypovolemic shock.
I would imagine, again, it's sort of outside my area of expertise.
Do you agree that severe abdominal pain and distension, a decreased hematocrit level, or hypovolemic shock may not be present at all with a spontaneous hemoperitoneum?
I would suspect it would be related to the volume of bleeding.
Do you agree that clinical signs and symptoms of spontaneous hemoperitoneum are usually nonspecific?
I'm sorry, could you repeat that?
Do you agree clinical signs and symptoms of spontaneous hemoperitoneum are usually nonspecific?
Again, it's sort of outside my area of expertise. It is outside my area of expertise.
All right. Do you agree that spontaneous hemoperitoneum, the diagnosis of that is frequently made on the basis of a CT scan?
frequently made. If it's present, it can be made on CT scan, yes.
Do you know what the AGR says about that?
I don't know specifically what the AGR says about that.
Doctor, I'm going to show you a picture that was taken by Dr. Wheeler at the autopsy. I don't know if you've seen that before today, but I'll hand that to you. And I want you to assume for the purpose of this question, that is a subcapsular hematoma of Miss Ayamu's liver found at autopsy. You just make that assumption hypothetically.
Okay.
Okay. In your professional opinion, would that have been detected by CT scan?
Objection. Objection to the form.
If that were present in Miss Ayamu's body, in your professional opinion, would have been detected by CT scan?
If it was present,
Yes, sir.
it would be seen on CT scan.
All right. Let's make that the next exhibit, please. And doctor, to be very specific, that would be a CT of the abdomen pelvis, correct?
Or CT of the abdomen.
Doctor, could you also see on a CT scan if Miss Ayamu had a pint of blood in her abdomen?
It's possible, but the density would have to be at a certain level to allow us to make that diagnosis with specificity.
Okay. What if that blood had been there at least for 24 hours?
Again, to make that diagnosis with specificity, it requires a certain density.
If you find a pint of fluid in Miss Ayamu's abdomen, do you report that on the scan? The final read of the scan?
It's difficult to quantify fluid. If there was a large volume of fluid, we would report that on the CT scan. If there is fluid in a distribution that fits with the clinical picture, we might also mention that on the CT scan as well.
When you say large volume, what do you mean?
It's hard to quantify on a CT scan, but if the bowel loops were, say, floating in fluid, or there was a large pocket of fluid on a CT scan, we would report that, yes.
Okay. Would a pint constitute a large volume of fluid?
Yes,
Would 2 pints constitute a large volume of fluid?
it depends. I mean, when you speak in pints, I'm not able to measure a volume of fluid. And so I'd like to clarify, when you say a pint as a large volume, I would probably not report that as a large volume. I would probably report that as a small volume of fluid, but it would still go in the report.
All right. And how would you make the determination whether that fluid was blood?
I would measure the density of that fluid.
And how do you go about measuring the density of the fluid?
We have a tool on our PACS machine at the workstation that allows us to place a region of interest over fluid, or anything else for that matter, and measure its density. Density is a relative number that is derived or arrived at based on how much or how little that substance or structure or organ attenuates or blocks the X-ray beam.
All right. Can you tell me whether the strike that, did you quantify the amount of fluid that you found on May the 7th?
I don't recall, as I'm not looking at the report.
Okay. Can you tell me whether it was less or greater than a pint?
I can't.
Okay. Do you need to look at something to help you make that determination? Or can you make that determination?
My recollection is that we refer to this as a small amount of fluid in the pelvis. according to this particular case and this particular report.
Well, I understand that. I'm just saying, are you going to be able to tell the jury the quantity of that fluid?
I would not be able to quantify that fluid in terms of an actual fluid volume.
Okay. Would you be able to say whether it's less than or greater than a pint?
I'm not sure that that would be accurate.
What is the smallest volume of blood that you can detect on a CT scan?
I'm not sure.
What is the smallest amount you have detected on a CT scan?
Again, I'm not sure in terms of quantity, but if there is a small area of fluid that measured the correct density and allowed us a measurement, and that measurement fell within a certain range, then we would be able to make that diagnosis, or more importantly, to suggest that diagnosis, because we're looking at a fluid or a structure that is attenuating X-ray beams. We're not actually able to open the patient and determine its true significance. We can suggest a diagnosis.
Do you agree that there's medical literature, specifically the AJR, that has reported that a volume of less than half a pint of blood can be detected by CT scan of the abdomen?
I would agree that if there is fluid in the abdomen that meets criteria for blood based on the density numbers, that we can make that diagnosis.
Did you have any role in performing the CT scan of Miss Ayamu's head on May the 10th?
I did not.
All right. Have you reviewed that scan?
I have not. At least that's my recollection.
Doctor, I want you to make some assumptions hypothetically. I want you to assume that Miss Ayamu's internal medicine doctor had ordered a CT scan of the head and a CT scan of the abdomen to look for bleeding. And it sent Miss Ayamu to the CT suite to have imaging done. Can those two tests be done back to back?
They can be performed back to back.
Would you use the same machine?
Yes.
And how do you go about, I should have asked you this earlier, how do you go about doing a CT scan of the abdomen?
The patient is placed on the table, just as with any other CT. The area for scanning is then scouted. We acquire a low dose, almost X-ray type picture that looks like a standard X-ray. That allows the technologist to plan the coverage for the scan to ensure that they're not scanning too much or too little. Once that's established, the coverage is established for the scan is then performed.
Approximately how long does this process take?
It depends on the equipment that is utilized.
Well, let's talk about the equipment that was used on Mrs. Ayamu.
Probably 10 to 15 seconds.
How long does it take for you to review, or no, I shouldn't say you in particular, but what's customary in the radiology department for the time it takes to review a scan of the abdomen?
Depending on volume at the time, it's usually within, and depending on whether it's ordered stat or not, the time can vary from 1 to 3 hours.
Okay, let's assume it was ordered stat.
Within an hour to 2 hours.
All right. Mary Lee, can I have that picture back, please, Exhibit 2? Doctor, if you or another radiologist had performed, a CT scan and detected a hemoperitoneum, such as what you're looking there on Exhibit number 2, what would the standard of care require you to do?
Objection to the form.
And what I mean by that is, what would be the protocol?
If an acute finding, such as blood, either within the peritoneum or adjacent to an organ was identified, then we would be required to communicate that.
All right, tell me who you would communicate that to.
To the ordering physician.
All right. And would that communication take place as soon as possible?
Yes.
And would you describe what you found on the scan to the ordering physician?
Yes.
And would you tell that ordering physician you found blood?
If blood was found on the scan based on, or a suspicion of blood based on density numbers was found on the scan, then yes, we would communicate that.
And would you agree with me that would be an emergency situation, wouldn't it?
Yes.
All right. Doctor, have you been called upon from time to time in your experience at Vanderbilt to perform repeat CT scans to compare what occurred or what was found on the first scan to what has been found on the repeat scan?
Depending on the situation, yes.
All right. And what I mean by that is you have looked at a repeat scan, compared that with the first scan to determine whether there have been any changes.
Yes.
Have you had situations in your experience where a repeat CT scan saved a patient's life?
Not specific instances that I can recall.
Have you had a situation where CT scan saved a patient's life?
Absolutely. If I may expand on the last answer,
Sure.
I'm not sure that it's a tricky question, if you will. The performance of the scan or what is done after the scan was acquired. It's a question of what saved the patient's life.
Okay, that was a fair statement. The CT scan in conjunction with the subsequent treatment saved the patient's life.
Correct.
Doctor, in your report, you state that this amount of small fluid can be the product of an ovarian cyst rupture. Is that correct?
Correct.
Did Ms. Ayamu have an ovarian cyst rupture?
I don't know.
You read the autopsy, didn't you?
I read the autopsy again. I don't remember the specific details.
All right. You said that it could have also been the product of ovulation, correct?
Can be seen in the setting of physiologic processes in the pelvis.
Was Ms. Ayamu ovulating on May the 7th?
I do not know.
You said it could be consistent with the passage of a kidney stone, correct?
In cases where there's inflammation, we can see fluid or edema throughout areas where we would expect to find such things. In this particular case specifically, there was stranding around the kidney, along the ureter, more on the left than the right, and we attributed that to potentially to recent passage of a kidney stone.
Do you know whether Ms. Ayamu had recently passed a kidney stone?
I do not.
Do you know if Dr. Wheeler found evidence of passage of a kidney stone in his autopsy report?
I do not know.
You said the finding can result also from a urinary tract infection. Can you describe that for me, please?
Anytime you have acute inflammation within the retroperitoneum or around the kidneys or along the urinary tract, there can be cases where edema or fluid could be present.
None of this, and I'll put this statement out there in the record, quote, the finding of a small amount of free pelvic fluid is very common in a woman of childbearing age like Mrs. Ayamu. The finding can result from ovarian cyst rupture, ovulation, urinary tract infections, and or passage of a kidney stone. The amount of fluid in the pelvis on the CT scan is small and in the common range for a 42-year-old woman. Why didn't you write that in your radiological report that you attested on May 7th?
Because we see it so commonly that much of that I believe to be understood.
You thought that the person who ordered the scan would know this.
That and the other findings that were discussed on the scan, I felt explained the amount of fluid in the pelvis based on my experience.
When you looked through the chart, could you see anywhere where you or Dr. Buchanan discussed the small amount of pelvic free fluid with Dr. Fitch or anyone in the emergency department?
Not to my recollection.
You also agree that the small amount of pelvic free fluid could be the product of bleeding.
Not based on the density numbers that we've seen.
Are you saying with absolute certainty there was no blood in Miss Ayamu's abdomen and pelvis on May 7, 2013?
I'm saying that the CT findings that are there do not allow for that diagnosis.
But you can't say that on May the 10th, can you?
The scan is from the 7th.
That's correct. You can't say that, though, for May the 10th, can you?
Objection to the form.
I'm not asked to give an opinion on that. The scan, again, the images that I have in front of me and the scan that was interpreted was from the 7th.
Doctor, I don't see in your report any reference to medical literature. Is that correct?
That is correct.
And I understand you're not going to discuss medical literature when you testify, correct?
The proposition of my testifying in court has not really been discussed, and any content related to that also has not been discussed.
All right, let me ask you today, as we sit here today, do you have any medical literature that you intend to present at the trial of this case?
No.
Are there any opinions that you intend to discuss at the trial of this case, at least as of today, that we haven't gone over here?
Or that aren't in his report.
Now, let me give you a report, but I ought to make this exhibit. Let's make this Exhibit 3.
Or I should say the CT report as well.
I want to hand this to you as Exhibit 3. That's what will represent to you. That's your opinion. I want you to go through it carefully and let me know, is there any opinion that you're going to give that we haven't discussed here today?
No.
That's all I have, Doctor. Thank you.
Thank you very much.
No questions.
Off the record at 10:09.